Welcome to This Week in Washington for Friday, October the 21st, 2011. This has been an extremely busy week within the association because a large number of our staff are participating in an institute next week in Colorado. This institute will bring together people from all facets of the transportation community, as well as people who represent transportation users, to discuss ways that they can work together to improve community and public transportation in the communities they call home. We find this to be especially important in Colorado since it is a urbanizing state with a large rural population. So many of our folks will be out there working with local community groups and participants to produce a series of what we call helpful efforts on developing coordination and coordinated resources. Speaking of coordination, I had an opportunity today to spend a significant amount of time with representatives from the ambulance industry. As you know, when I've been talking about coordination, I've been talking about building a network at the local level that can serve the transportation needs of all of the people who live in a community, and some part of that need will be met by the ambulance industry, especially non-emergency ambulance services. As we all know, this is a major issue when dealing with Medicare and Medicaid, and it is a major issue for those of us who provide services under dialysis, since many patients often end up with the need for ambulance services. During the discussion, I learned how complicated and complex ambulance billing can be, and how the ambulance industry feels, as we do, that there are a large number of trips being provided on an ambulance when people have no other options available because there is insufficient community and or public transportation to provide their needs. I hope that this will lead to a number of different discussions in the future in which we can share ideas about how we can build a much more seamless customer service oriented approach to especially medical transportation. One of the things I learned in particular was that despite the complaints that we often have about record keeping and trip reporting in comparison to, for instance, what people have to do in the ambulance industry, it's staggering to me the amount of documentation and record keeping that is required for each trip, even if that is a non-emergency trip and even if it is provided in a stretcher carrier. So I think there's room for common discussion here and for looking for common ground with this important part of the mobility industry. Additionally, this week, as you know, the House of Representatives has been away, but the Senate has been here. And earlier this week, the first separate piece of President Obama's jobs bill went before the Senate. This portion of the bill provided help to state and local governments to maintain salaries for teachers, police, and firefighters. The Republicans in the Senate managed to prevent this legislation from being passed. We're, of course, concerned about the implications this has because we know that the transportation bill will be submitted as separate legislation as well. We're not sure exactly what the direct connection will be to this bill, but in some respects, unlike that one, we at least have some revenue of our own as an offset to this discussion, as opposed to the 100% funding the President was seeking in this bill without any offsets at all. So we'll try to keep you informed of that as the situation develops over the next 2 weeks. I'd also like to say that I'm looking forward to seeing almost all of our board members in Albuquerque in about 2 weeks at our next board meeting. I think that this will be a very good meeting for us, and by now you have probably received your information from Bill McDonald about the minutes of our last meeting. I hope that you'll be receiving early next week a draft schedule for our 2 days in Albuquerque. We have lots to talk about, and we have lots to engage each other in as we think about what our next step should be for transit funding, as well as for the continuing issues that we are discussing in medical transportation. On the agenda, of course, will be an election for the 2 positions on the board of national director that are opened, and the 2 nominees we have so far for those 2 positions are our distinguished president, Ann Gilbert, and our distinguished former president, Bill McDonald. I think that event and the election will come early in the meeting. As we look forward to next week, I plan to have a longer, formal sit-down meeting with the new president of APTA, as well as the retiring president, my friend and yours, Bill Millar. We had a brief discussion last week about issues and concerns that we have, and we thought we'd have a detailed discussion about their priorities. I'm very interested in finding out if there is any support in the new APTA administration for supporting the Carnahan bill and the flexibility for transit systems that we've been seeking for the last several years. I hope that I'll hear something that would inspire optimism on my part. Finally, I'd like to mention that I just learned yesterday that our friend and former FTA acting administrator, Nuria Fernandez, will be going to work as the Chief Operating Officer of the transit system, the MTA, in New York City. I certainly want to wish her well, and I certainly want to try to regain contact with her again, because we'd like to see if we could get some people within the MTA more interested in the issue of operating assistance. I'll be sure to let you know about that. The other change is another one of our friends, Karen Ray, who is currently the FRA administrator at USDOT, is also leaving for the MTA. So there will be some interesting, very experienced people that we know holding key positions there. Perhaps, as I said, this might be an opportunity to see some change in their position relative to operating issues in transit. So that's all I have for today. I hope that you have a nice weekend, and I'll be here next week. If you have any ideas and concerns, please pass them along. We'll know more about the transportation version of the jobs bill next week, and I hope that we'll be able to report there's some progress there. Thanks, have a good weekend, and again, goodbye for now.